Um, so let's go ahead and get started. Hi, everybody. It seems like today has been a popular day for meetings, very busy day. So we apologize. We're going to try to energize ourselves and you as we proceed. I think I've met everyone. I'm Amy Friedlander. Sharon?
And I'm Sharon Easterling, and we are kind of partners in crime for this. So looking forward to doing a couple of really deep dives and seeing how far we can get on this really important topic.
And oh yes, Paula, please finish your lunch. Don't rush. We were honestly, all of us saying we had been so busy today, and I cannot find. I'm going to have to do this one more time, I think. I'm sorry.
Amy, I've actually got it up and ready if you want me to share.
It was just because I think.
Yeah.
Yeah. It's not liking. I'm sorry.
That's all right. Here, I've got it.
Okay.
My problem is always configuration. All right. Can you see it?
Yep. Perfect.
Okay. So let me expand that so I can see everybody's face. And all right. So this is what we're thinking for our agenda today. And this is a community of practice, which means it's not a lecture, it's a conversation. So you should feel very comfortable chiming in at any point. So we want to take a couple minutes and help everyone know who's in the room. Talk a little bit about the background and context. We're going to do a very high level review of the data that you collected. We basically have one screen for each project, but so that's to give you all a sense, essentially, that we're sort of all in the same boat, that we have similar problems. But we're hoping that that data is also going to be kind of a rich minefield for you. So for Wisconsin and Iowa, you guys didn't either we didn't get it or you didn't have the same full set of questions, so it's not fully there, but that's okay. We've got what we've got, and we'll share that back out with you. Then we want to talk about sort of what has been our thinking about how shared services really can be an answer to these really pressing problems. And then we're just learning more every day about what's possible to do. And Amy's kind of untapped a whole mother lode of resources. We're going to share some of that with you. Know that we don't know everything about this, but we have a lot of good questions and we can sort of learn together. So that's where we want to go. And we're going to start with introduction. So I think everybody knows Amy and I. So maybe we could have our project folks introduce themselves. So Carla, would you mind starting? And for introductions, just sort of tell everybody a little bit about the work that you do, your role, kind of the size of the group that you're serving, and essentially just give us your elevator speech.
My name is Carla Hoftalent. I'm the Senior Program Manager for Southwest Human Development, and I oversee a program called the Early Childhood Business Management Program. We offer coaching and training to early care and education leaders throughout the state of Arizona. We have 4 pillars that we use: automation, the iron triangle, individualized coaching, and vetted policies and procedures. And we utilize the Arizona Toolkit, which is the CCA for Good model here in Arizona. So we partner with AZAEYC. We are expanding to this year, serving what we hope is about 200 providers throughout the state of Arizona, as well as offering some specialized subsidy training for the state of Arizona, our DES subsidy. Glad to be here.
Thanks, Carla. That was perfect. Is Kathleen here?
No, I just reached out to her.
Okay. How about Wisconsin folks? Looks like we have Paula.
Yeah, hey, I think Kelly will be here a little bit later.
Okay.
We had a number of, you're right, I don't know what it is about this day, but I realized last night I was double booked 3 times today. So I had to do a lot of last minute scrambling. My name is Paula Drew. I am a co-director. So my co-director's name is Kelly Matthews of the Wisconsin Early Education Shared Services Network, or WESN. We are a statewide shared services network that is housed in our state AUIC affiliate. We have 3 tiers of service, ranging from tier 1, which is really focused on basic information sharing and utilizing the ECE shared resource platform as well, to tier 3, which is a deep regionalized approach to shared staffing with shared substitutes and back office staff, and a deep level of coaching. Technology is woven into everything we do. CCMS, the CCMS we work with is ELV Alliance Corps. And I think that's probably enough for now. Does that sound okay, Sharon and Amy?
That sounds great. And actually, we should say, Carla, that your guys all use ProCare, right? I don't
That is
remember
correct.
that, but yeah, that's helpful. Thanks. Let's bounce over to my left-hand side and do the Iowa folks.
Hi there. Well, I'll start. I am Tammy Ingebrigtsen, and I am with Iowa AUIC, and we are, we don't have an official Shared Services Alliance in Iowa, but are working on it very soon. The state has been doing some things as a whole to kind of bring shared services here. But currently, I am the manager of a project called the Early Childhood Quality Improvement Project that works with a group of 15 centers around the Des Moines Metro that do some shared services. So we have, I have a team of 5 consultants that work on quality within the centers. I do some admin teamwork. We also contract out for them to use services for childcare assistance, billing, as well as CACFP billing, and some financial services as well. So, Ashley, you want to do a quick intro?
Sure. I'm Ashley Oddie. I'm the Director of Workforce Initiatives, Iowa AUIC, heavily involved in the teach and wages programs, and have been working on a moving the needle on compensation project for the last now probably almost 2 years. So looking forward to some sharing and learning about how we might move that needle a little farther, a little faster.
Great, thanks. And you guys aren't using a common CCMS right now, right? You're just
No, many
That's
of
fine.
my centers use ProCare, but it's not, if they're using it, it's very, very little, and they're not all using it.
okay. And United Way of Southwest Virginia, Susan and Audrey.
Yeah, hi. I'm Susan Patrick, the Director of Childhood Success here at United Way of Southwest Virginia. We serve 21 cities and counties in the southwestern tip of Virginia, which is almost 20% of the state, with a number of different initiatives related to childcare and quality improvement. We also have been working towards shared services for a couple of years now, starting out with using a Wonder School platform and just really working on our systems building and getting people all around the region to know and understand about the importance of early care. And we're now working in the economic development field. So sort of making the foundation and the argument for childcare is essential to economic development, in that the childcare workforce is a significant piece of that foundational economic support that has to be in every community for the community to be successful. So that's kind of why we're here, and the argument that we're trying to create for ourselves as we continue to build out our programs. And Audrey is also here with me, and everyone has mentioned it, overlapping meetings. So I'm here for a little bit and then I have to jump off for another meeting. But Audrey will be here throughout the whole meeting. So Audrey, you want to introduce yourself?
Yes, I'm Audrey Kirk, and I'm a childhood success manager, and I am overseeing any of the shared services initiatives, and also I take care of mixed delivery in our area, which is a program that provides preschool in private settings using public dollars.
Great. All right. So, Amy, you want to talk a little bit about what's led us to this moment?
Sure. So Opportunities Exchange, some of you may have heard Louise at our conference in Austin talk about, some of the work that we've been looking at in the field, lean impact, and just thinking about where are we headed as a small, mighty group of national consultants. And so we really wanted to think about, how can we have a greater impact and how can we scale the work? It's what we're always asking alliances to do. And we wanted to step back and take a look at that for Opportunities Exchange. And in the midst of that conversation, and we are getting some consultation support ourselves, thanks to a Pritzker grant. So, as we're having this conversation and pursuing this work, of course, we have this labor market challenge, these staffing crises in every industry, and very, singularly and particularly at an extreme level of pain in early childhood. And then I think the third piece that really struck us was the calendar. We were talking at the top of the call about facing the fact that summer is nearly completely behind us. That means fall is ahead. That means that it is time for, open enrollment on the ACA marketplace. And so we had started to think about how can we, Opportunities Exchange, get a little more intentional and directive with alliances. We know every alliance and every project is different, but we also know that there's sort of some key dates on the calendar that are really important for childcare. And so we started to think about what those dates are. When do we want to focus on tax prep? When do we want to focus on raising rates, setting tuition rates? When do we want to think about benefits and so, and workplace compensation, compensation and workplace environment, et cetera. So all of a sudden we were just churning and churning around staff, educators, and really feeling like we all entered this work. Opportunities Exchange was created not to create alliances, right? The alliances are a structure, they're a means to the end. And the end is that we have a well-compensated teaching force in ECE, that our educators are well paid, that they stay in the field, and that they help, they then are able to realize quality. So we started to really think differently about compensation and about how we could join forces with folks like yourselves who are working with so many providers and can really try to implement some of these ideas.
Great. So let's go through the survey results very quickly. I tried to use the same set of graphics so that things would basically align. And I will share with you the things that I want you to mostly pay attention to are this, how many offer health insurance and how many participate in health insurance in particular. Salaries you're going to see are kind of pretty consistent across the board. The one thing that I found sort of surprising is that most people reported a high level of paid planning time. We could dig into that a little deeper and see what folks mean by that. When I was in Virginia in June and we looked at that number and also thought it was high, and the United Way staff thought that was probably due to the fact that people were counting like nap time as paid planning time. Not really sure, but let's sort of stay with the fundamentals. So Battle Creek is a fairly small alliance with 5 members. I think they had 4 respond and 3 who responded to all the questions for a total of 70 staff. And then 75% of their members do not offer health insurance. And of those who do, only 6% participate Amy, is it okay if I go through these really quickly? Is that okay with you to
Yeah.
kind of point these out? I should say for everybody, is that okay? But Southwest Human Development, Carla, these are your numbers. So 82% did not offer health insurance and less than 5% participated. There were a total of 32 programs. And when I say surveyed, I mean responded to the survey, because you had many more that you sent it out to, and a total of 379 staff were represented in those 32 responses. Oh, the other thing that I think is really important, and one of the things that we want to sort of lay out as part of our rethinking this, is watch this number also. How many employers, how many of the employers, as in the childcare directors that you work with, track the health insurance status of their own employees? The vast majority do not. It's probably one of many things in our field where we think, I don't really have a solution, so it's better if I just don't know. I'm sort of guessing that that's the thinking behind it, but we want to assert, I guess, that behavior should probably change, and you guys should probably be thinking about how you can create more agreement around the fact that as an employer, I need to understand whether or not my staff have health insurance, and then we figure out what we do about it. But that's a pretty important thing to know for a lot of reasons. The other number to look at over here on the left side is how many use a benefits broker. And we'll talk more about that as we go through. Please jump in if your screen comes up, or if you want to say something or add something and you have a question. So this is Southwest Virginia. Again, 65% do not offer health insurance. I actually think that number was higher. In other words, more offer health insurance, in part because one of your respondents is a hospital-based program, and or in a larger institution, and they get the benefits. So I think that it was almost like it was an outlier. I mean, it's still really low, but less. And then that number was higher than most, again, for that reason. 17% of programs used a benefits broker, 4% tracking the health status of their employees. Oh, the other thing, I haven't pointed it out, but you'll see, and you'll get a copy of this PowerPoint, but very high numbers of not fully staffed. So we just can't even convince people to take jobs at this point. Did I do? I think I did two. Let me go back. Iowa. So we just had some partial stuff. Iowa, our Iowa colleagues they're pretty new in this space. We just recently found out that they've got this very cool compensation initiative, and so we wanted to include them. They had surveyed providers with a different survey instrument just a few months ago, so we didn't want to have them go back right now and do that. That's why we don't have all the answers, but you see the that 47% are not offering any health insurance. This may be something that you want to go back and tease out a little bit in the future, how many of them use a benefits broker and how many track the health status. There were 15 programs that were surveyed. Salary range is pretty consistent.
Some more data here too, that I know there are 200 total staff.
Okay.
I would say none of them track health insurance status, and none of them are using a benefits broker.
Interesting.
Yeah.
Okay.
Is anyone else having trouble hearing Tammy? I don't know.
A
if it's-
little bit.
Okay. Maybe you can lean closer to your microwave. Don't lean closer to your microwave. Your microphone.
There's 200 total staff when we surveyed them in January. So 200 total staff, I would say none of them track health insurance status. They might sort of know, but they're not tracking it in any formal way. None of them are using a benefits broker. One of them was fully staffed. So one of the 15 was fully staffed at that time. most of them have a wait list due to staff shortage. Probably the other 14 do have
Right.
that wait list due to staff shortage. So,
Great.
yeah.
Thanks, Tammy.
Yep.
And then Paula, just tell us, I know that you've had an incredibly busy period in the last few days and weeks. So you can probably tell us off the top of your head some of these high level numbers.
Yeah, we just did. So Sharon, I can't remember if it was you or Amy I was talking to. We sent out a survey. We had already had one in process. We worked with some folks from the University of Wisconsin. We wanted a lot of the same information and then also some things about enrollment. So we added a few extra questions that should get at mirroring the same. We didn't get, as of, we were going to close it on the 19th and we had 174 responses, but we wanted a greater, there's nearly 4,000 providers in the state of Wisconsin, and we really wanted to get greater responses. So we put it back out. So I haven't looked into the data yet. But, you know, what I suspect, the reason why we did this is because we have some deep assumptions about these things, but to push on advocacy, we need the hard data and what's happening real time, which isn't existing right now. What we know from our coaching work is that there are deep wait lists. There are some counties of our state who providers will say their biggest problem is that parents keep calling in the middle of the day. They're full and they just can't even take the phone calls anymore. There's huge staffing shortages. It is rare, even in the most resource heavy places in the state, including Madison, that folks would be fully staffed. Most cases, directors are working in classrooms all day long, and that's pretty much the normal anywhere in the state right now. I think because of that, all paid time planning and paid time off is skewed because the staffing challenge is so extreme right now. And I see all of the rest of these things really reflected back in how much a particular region of the state is resourced. So for example, in Madison has a special unit within the city that works on childcare initiatives, and they do accreditation and they put a lot of resources into that, which means a requirement for city accreditation is that you do offer paid planning time. You know, there is a requirement for paid time off, but then, you know, so a lot of this really makes me think about, I know this isn't the details, but policy, right? And setting standards, and then people find ways to align with them. And also thinking through like the model work standards from the Center for the Study of Childcare Employment, which we use in our work all the time as sort of a reflection. We have a 16-hour business training series that we do that takes a whole section to talk through those policies, particular to these, you know, different workplace supports and how that then ties back into quality. So I know that's not the deep details you're asking for right now. Statewide, I know we have about 50, really maybe just under 50% of people who offer health insurance, and less than that actually take up that health insurance because it's too expensive. Retirement is much lower. I think it's like 15 to 20%. Salary scale, this is a total guesstimate, but if we were talking lead teachers, I would say is really likely between $11 and $18 statewide. So that's a big continuum, but there's a lot of various parts of the state.
Right.
So Paula, what is, excuse me, do you have you reissued the survey with another close date, or are you just leaving it open until you get a certain number of responses?
Yeah, so I just got back from vacation on Monday. I opened up the survey, realized we didn't get as many responses yet that than I'd hoped for. So I think we're going to give it another 2 weeks and ask like the state to send it out on their listserv. We're doing the essential not expendable listserv. I don't know if you guys know about that or not, but it's through, well, it's not listserv, it's a Facebook page, but there's like 8,000 providers on there across the US. Obviously, we're only looking for Wisconsin specific data, but it was born from a Wisconsin provider. So there's lots of Wisconsin providers on there. I'd be happy to share, like I could download what we have now, Amy, and share that with you if you want to just put your eyeballs on what we have currently.
It can be separate from this meeting,
Yeah.
but when we, because we can update these slides before sending them out to everybody, even with the partial data.
Yeah.
Again, to make sure that our hypothesis that we're all in similar boats is holding true, but that's great.
And this is we are putting this out to everybody in the state, not just WISN providers, but our hope is that we get enough people responding to it that we can do a comparison. Who's in WISN, who's not? What do these squares tell us about what the network is doing? Because we're going through this big evaluation right now, this is going to be, we're grabbing any data we can, and this is going to be also an interesting comparison, which is why we wanted 174 people is a great swath of people, but I wanted it to be a little bit higher.
Yeah,
Right.
that makes a lot of sense. That'll be really, really neat if you can pull some of that from the data. So, all right. So some of you have seen this graphic. We keep working on it and massaging it and filling it out a little bit more. But so, this is kind of an idea that we want to start, I guess, embedding in Shared Service Alliance work, right? That just like we have quality standards, we need to have a sense of what the standards ought to be. And Paula, actually, I hadn't really thought about model work standards for a while. We used those a lot when I was in Philly at DeVacy, but so that's a helpful reminder that we should probably go back and look at that. But just in terms of standards around employer benefits, this is kind of what we're thinking, that the bottom line should be that every employee has access to healthcare coverage, and that probably a big swath of the field is going to be eligible for the subsidies that are available through the ACA, right? If you think about, the subsidies that are available for childcare, we want every family that would be eligible for that to take advantage of it. Well, this is similar. The Affordable Care Act has been around, has gone through some ups and downs through times of full funding and not so full funding. And we're sort of back on the full funding cycle now. There are generous subsidies such that most low and moderate income folks won't have to pay very much at all for a really good health coverage. We want to make sure that everyone in the sector, all employers really understand what's available. And they facilitate that. We'll go into more detail about that, but that's sort of our bottom line, and that lead teachers do have time to do their job, which is to plan, to think about children's needs and to plan accordingly, and to be able to do that in work time, in their work day is important. So we kind of see those as a foundational, a baseline. And then adding on to that would be supplemental accounts that help pay for the cost of medical and other expenses in states where you have teach and wages and other kind of workforce initiatives, apprenticeship programs, other college scholarships. How does the employer facilitate their employee access to those benefits, right? And then kind of the next phase up are other kind of deeper, richer benefits packages that kind of surround the employee with other protections and kind of create a safety net. And then the retirement plan. Amy, I think we're sort of discussing whether retirement should be at the top or it should be further down. But I wherever we put it on the continuum, it's got to start being a part of our conversation if we
Right.
expect people to work in this field for a full career, right? So, any thoughts, reactions, ideas related to that sort of bottom line?
And Paula, when you were mentioning, standards and, advocating around policy, I mean, part of what we were hoping is that we might be able to generate a conversation amongst us around, well, what are the standards for, we don't want to set up barriers for providers to participate in initiatives that are meant to help them reach their goals and support the families and children they serve. At the same time, it's questionable about whether our work is going to be impactful if the staff keep turning over and, if they're plagued by staff shortages, et cetera. So part of this idea was, are we comfortable as an alliance or as an initiative working with a group of providers to assert standards around the benefits, the salary scale, HR administration, and what supports can we give to get them there, right? It's not like you must have this, go do it, and when you have it, come back, but needing to have this, as Sharon says, let's say it out loud. Let's say what our expectations are. Let's say why we believe these are key factors, what difference we think it's going to make, and can we get more specific about some of those issues?
Yeah, I think I have so many, I don't know if you guys know this, but my graduate research was on workplace policies that support quality. So the intersection of early educator, workplace well-being, and quality care kids receive. So I could say like a million things on this, but I'll back everything up and say just a few tiny things. One thing is that I would also reflect back, like, what as a network can you do to take that burden off the provider and make it a benefit of the network? I think that our network is going to be, delving a little bit deeper in some interesting work with the employee assistance program that we're developing, that will kick off January 1st, but we're researching right now and doing things, definitely different than the standard EAP. Thinking about lending, and then also telemedicine and teletherapy. Those are all things that we've figured out how to do within our network. And then I always just love to lean into this field or this thought of, and what else is possible within a network? And then the other side of that is empowering the provider with savings that you will be gleaming from being a part of a network. How much is it? 30% we want you to dedicate back into some part of this triangle. And the thing I like about the model workplace standards, the reason I like to use it for a lot of reasons, but now they have a workbook that actually goes with it, and it's specific to a childcare program individually to work with people, educators, administrative staff, board members, parents. Pick 3 big goals that they want for their program that are related to those workplace policies. And it's this whole sort of timeline of how you can reach them. You have to budget for them, all of these different, it's just a really lovely workbook of these are your individualized goals, and we're going to help you figure out how to map them over time to achieve them.
It's like self-study.
It's sort of like how we do our coaching. And so it fits really well. And then they can see over time that's going to save them money, right? That retention piece, you think about turnover, it's going to cost you at least $2,000 for a group center, if not much more. So if that's what you're going to pay when you lose somebody, plus the emotional toll on other people, what do you want to just invest that in to get them to stay?
I think that's a really interesting point. And thank you, Amy, actually also for kind of putting it out there like that. I sort of feel like that we have a lot to learn from our work and conversations in quality standards, right? We are really comfortable saying this is what we mean by a quality program. And and here's the standard, and research shows this. we are far less comfortable, I think, talking about business standards or HR standards or any of this. And again, I think it goes back to us feeling like, well, we don't have answers to it, so maybe it's better if we don't talk about it. But I think Amy and I both over the years have heard a lot of stories from Alliance leaders about bad behavior on the part of employers, decisions to, turn away money, turn away blended funding because it's, it's more hassle, or, keep a lot of administrative staff when automation makes it possible to shift more resources into your teacher staff. I mean, those are just two examples, but so I think it's an important question to wrestle with as leaders in this space. How can we get further down the road by asserting that these are the expectations and here are the resources, but these are the expectations? And it's time to stop just talking about how bad things are and start talking about some solutions. But you can probably tell I'm a little tired. Having been a worthy wage campaigner since about 1991. So, yeah.
I think that Paula gave me a light bulb moment that I just want to share so I can process it out, is because I think there's so much psychology in this and talking to providers. I also see a lot of bad behavior, but I see a lot of early care and education leaders, owners, directors in trauma. And even when given large sums of money and great strategies to provide benefits, to provide retirement, it is almost such an unattainable thing for them that they immediately reject it. So I did have this amazing light bulb moment, Paula, when you were like taking chunks. You said it in a different way, but it really meant something to me in really going back and maybe taking chunks to do that and have that expectation. And so I think building some of this capacity, Sharon, is what you said. We got to keep talking about it. We've got to, because it has been so, nope, we don't do that. No, we don't have that. No, we can't do that. That there is not even an understanding of assessing. Because I was looking at our survey, we provided a benefit broker to folks. They came to a meeting, we vetted one and said, here is this person, and he will go to each of your programs. And still, I think only one or two folks, embraced that. So anyway, thank you, Paula. And this is a great conversation.
Yeah, I think you are so right. I was in Iowa last week and I talked with Tammy and Ashley and the folks there. And we talked a lot about the psychology of all of this, right? That we've just become so accustomed to thinking that we can't solve the problem, that we've got to overcome a great big hurdle in helping people believe that it's possible for us to do better, because a lot of folks just don't believe it.
Yeah.
So in terms of, well, actually, Amy, I'm going to have you talk about the slide because you actually are doing this work with folks.
Well, I think that I do some HR professional development work with a colleague of mine here in Philadelphia, and we have these PD sessions, and then we sort of have homework for our providers that are participating, and we encourage them, submit whatever you have, then we give them feedback, and we try to encourage them to make changes. And some folks are more receptive than others, but it's I think it is constantly, it's pretty eye-opening to take a look at some of these, or to see how many of these businesses just don't have these items, right? So this was a part of, I feel like these are a part of the workplace kind of environment that we want to support. We as alliances want to say, and this is a place where I totally agree, like this is a benefit of being part of our alliance. We can support support you in making these things happen. Let us review what you've got with your HR manual. Let us give you our input and talk to you about why. Let us take a look at your job descriptions. Most folks don't have a benefit summary that I've seen, just a quick and dirty list of what their benefits are. That's it's like, that's the first thing you need to do. You need to write down your goal, right? So you need to kind of come to grips with, oh, I'm not really offering any benefits. I mean, I found it pretty surprising. Here in Philadelphia, we do a lot of stuff wrong, but one of the things we do right is we have a city law that, requires employers of a certain size to offer paid sick leave. And and I know Carla and I have talked about this because they have something similar in Arizona. We still have providers who are not cognizant of the law, not fully meeting the law. So, but at a minimum, we should be able to say, this is a benefit we offer our employees. So I think we are not asserting a norm. We are not asserting an expectation, I think, and similarly, the salary scale, as we have, power to the profession and things really trying to take hold in the midst of a very challenging financial time for the field. But nonetheless, it seems like a huge opportunity to work with providers in our alliances and networks to sort of reframe and really look at the salary scale or develop one if they don't have one in a way that is, set to align with these three types of educators, and that can be, adjusted locally based on state QRIS, et cetera. But again, this idea of really the salary scale to me is such an interesting way of bridging all the finances of an organization and all of the quality systems and standards that are in place, and the expectations that we have for our educators. And it's such an incredible way to put on paper, look at what this career could be. And oftentimes it's a missed opportunity. And then again, we always talk to the folks in our class about, your most fundamental relationship with your staff is paying them, right? So you need to give them a way to document their time, and you need to pay them according to the time that they have worked. That is the bottom line. And again, not everyone is automated, and not everyone even uses automation. If they are automated, they don't always use it to track leave time. And I don't think it occurs to them that they're stealing time from their staff. I really don't think that's the intent. But as an employee, I know I check my pay stub every time and it was automated, but there can still be mistakes, So to my mind, I think this is a place where Alliance Hubs can really step in and do so much. And we were just trying to think, do we have all the templates that we need? Do we have the tools and resources? Have we shared those? And, does this resonate for you guys in terms of what you do already or where you would like to go?
So let's jump in. Because I think there's probably some good conversations to be had here. So, so this is another way of kind of looking at implementing that scheme that you just saw. So, a shared service alliance could think about how to begin, delivering HR services. And actually, we see now a great trend in shared service alliances in really focusing on HR and HR practices. So these are the fundamentals that Amy just sort of walked us through. And then we're going to talk a little bit more about access to the ACA marketplace. So as we said early we said at the beginning of the meeting, open enrollment is November 1st through January 15th. I actually went in and checked every one of your states to make sure that those dates were correct, and they are. So we know you've got a window, limited, but you've got a window that you want to, so it's not, as you can see, it's not too early to start having conversations with employers about what they're doing around this. So, so for each of the topics that we're going to kind of dive into a little bit more, I created these tables where I tried to be really specific. What's the hub's responsibility and what's the expectation around the provider responsibility? So hopefully this will help us really think about how to begin to create some action steps. So let's talk about navigation. So if a person accesses health insurance through the ACA marketplace, that's an individual plan. And it's the contract, if you will, is between them and the insurer. It's not an employer sponsored benefit. So what is then the role or the potential role of an employer who wants to help staff members access insurance via the marketplace? And how can a hub help to facilitate that? So this is my thinking about it, but I'd love to hear your thoughts about other ways and strategies. So here's what I was thinking. The hub, the role of the hub could be, first of all, to identify the navigator resources in your community, right? So to do a little bit of research, to figure out what's available, maybe to reach out, talk to some folks, and just get the lay of the land. And then as you're doing that, bringing program leaders along in the conversation. Do you know about this resource? Do you know what it means? Here are some materials about it. There's a lot of really good information on the healthcare.gov website. There are videos, there are other documents that you can access. So your role as a hub leader could really be building a bridge between this kind of fairly new resource that's available and those who could benefit from it. And then, you know, continuing to follow up. So what's the role then of the program director? As I see it, it would be to, like, you know, listen to the presentations, read the material, and then to follow up with the navigator to schedule on-site meetings. So Amy and I have this idea that the employer could actually, you know, schedule some time and say to staff members, this is an important resource for you to know about it. We want to help you with it. Here's a calendar. The navigator will come on site and we'll meet with you privately. You can step away from your teaching responsibilities and have this meeting, and, you know, just really kind of creating those pathways to make it accessible for folks. And then, you know, to follow up with staff to see how's it going? Are you getting what you need? Do you have any questions? So the roles then for both the hub and the program administrator are really about facilitating this happening for staff. So that was my thinking about it. What's your thinking, your reaction, your response to how this might or might not work, or what could make it better?
For us, I think because we did do something like this similar last year, I think one we have to start earlier. So that's because I think we're a little late going in November. Start earlier. And then I think maybe for us as a group, we need to offer some of those meetings to where they can send their staff. Because I just don't, there wasn't the follow-up from the program directors when we gave them all the materials and we gave them a navigator or showed them how to access one in their zip code. There was not that follow through. We had a lot of people come to that meeting where the navigator spoke and we presented, but then they just didn't follow through. They just kept saying, it's something I want to do. It's something I want to do. So maybe for us, if we then gave those opportunities for their staff to come to the meetings, that could help if we created them.
Yeah, interesting.
Yeah, I also think this is an area where sometimes we get nervous about, HIPAA and, get a little squeamish about health data and, but, it may be that an alliance or a hub has to model this idea of asking this question, so not just what benefits do you offer, but how many of your staff have any type of health insurance, right? Because I think if we're not asking that of the providers, it might not be so obvious that the providers need to ask that of their staff and need to consider that a priority.
Yep.
I wonder if gauging centers' goals around some of these supports might identify some good places to start. If you
Say more.
have some centers that are articulating back to you, yes, I have a goal to provide health insurance, as opposed to not on my radar and I don't care, to just identify some places to make some movement.
I think I really appreciate that comment, Ashley, because for good or for bad, we have a lot of areas where we could dig in here, right? There's a lot of challenges. Many of them are related, but each one has to be addressed in and of itself. And so I was kind of surprised by that. And I'm not a researcher, Sharon's not a researcher. We created some survey questions. Maybe we could have worded them better or differently, but sometimes you get confounding data back. But I was a little bit surprised to the extent this is what people meant, that as many providers as you all surveyed said, I'm not interested in offering that stuff. And so, again, I think that may be some of what Carla is referring to as the psychology. I don't know. I don't know if it's that they really, really just don't believe that it is affordable. But I think you're right. The work would go more smoothly, more quickly. We don't care if one employer, addresses health insurance and connects to the ACA and then does the salary scale and then does that. And then we don't care about the order of these things. And certainly if we were addressing these according to the pain points of the employer or the goals, asset-based language, the goals of the providers, then we would, likely that work would be more smooth. But sometimes I just don't know if providers, if we really help them understand that this is doable.
I would say what I would anticipate hearing back from them is that's such a long-term goal for them that they can't even focus on it right now. They're so caught up in, I have to fill my staff openings. I have to then enroll my center once I've got those staff openings. And then I have to think about quality on top of it. In that order, that thinking about navigating health insurance for their employees is just not even off their radar at this point. It's something they feel is manageable.
And so picking up on what Paula said, if the response to that from you all, your entities was, you don't need to do that. As an Alliance Hub, our role is to make sure that each of your employees has some health insurance. And we will talk to them, right? Do they have health insurance through a parent, through a spouse? No. Then we will make sure they get connected to the ACA marketplace. And we can't insist that they buy something, but we will make sure that they feel supported by you through our work around this issue.
I think recognizing that that administrator or that director could be a roadblock because of their own capacity is very real. And even their sort of like emotional capacity to, like Tammy was saying, think of one new thing. And so connecting with each individual staff, this is something that we will be doing soon with our EAP,
Right.
is something we haven't done before. We always work with those owners or directors, but soon we will be providing a benefit that is available to each individual worker within all 3 tiers of service. So this is going to be a large swath of people. Once we have that sort of like it is, so whatever it is, it's starting with the ACA, it's whatever that benefit is that's going to touch them, that you can say to that director, we just need the email list or a staff meeting. And then we'll do this on your behalf. Then it's something off of their shoulders, it's benefiting them, and you're directly connecting with the providers. And these things, I don't know if this is the way it is in every state, but Wisconsin has like really well established navigators all over the state, and a few statewide organizations that we've partnered with year after year to do sort of like double duty on making sure everybody knows about open enrollment and those sorts of things. And we don't even have to hire somebody on our staff to be that navigator. This is their work. They want as many connections as possible. So for us, it's just sharing that information out there. Here's exactly how you go about this. And then a real human is going to walk through this with you, and they're going to tell you what's available and what the different plans are. I'm making an assumption that's the way it is in every state. I don't actually know that, but
It's supposed to
as
be.
an alliance, it might not
Yeah.
even be that hard,
Right.
to make that connection with the folks that are doing this every day, all day, is connecting with individuals and getting them signed up.
I think that's a really, really good point. And again, that's why this is a community of practice and not a presentation, because we're sort of figuring it out, right? But, one of the things that we've tried to understand more about is when should a shared service alliance build capacity with a provider, and when should they take on the work themselves? Right. And we're still trying to understand how to discern that better. And I think you guys have put your finger on a really critical question. Like, there might be some directors who are waiting for an answer. And if you give this resource to them, they can run with it. And there probably are a lot more who say, gosh, that's a really good idea. As they're answering the phone for another call out, right? And they have to go substitute in a class. So I think that that's actually pretty brilliant. I'm going to move to the next screen, knowing that we're going to keep coming back and forth on these topics, but let's look at this question about the benefits broker. Some of you have done this already or have tried this. Somebody told me, I did a webinar a couple months back with a group of providers in Vermont who have been in a shared service alliance for a couple of years. And they, leadership wanted me to meet with them because the directors were saying, we're just not getting benefit from our shared service alliance. And so I said, well, talk to me about what you're doing and what you need. And one of the directors shared this story about how she had spent like 2 full days the previous week researching healthcare options for her staff. And despite all of her best efforts, she really wasn't confident. She'd kind of picked out a plan, but she wasn't really confident, A, that it was the right plan, B, that it was the good price. And I said back to her, would you expect an insurance salesman to do lesson planning for your 3 and 4-year-olds? Probably not, right? Because that's not their field. So we have you have an opportunity to tap into someone who understands all the nuances about the market. And here's the best news. A benefits broker doesn't even charge you for the work they do. Their time is paid for from the vendors who sell you the product. Now, you could argue it goes into the pricing, but you're not going to get a discount if you don't use a broker. I can guarantee you that. So why wouldn't you? And so beyond health insurance, right? If you were using a navigator for the marketplace beyond health insurance, there could be a whole list of other things that at the end of the day aren't terribly expensive, but could really enhance the value of the benefit package that you offer to folks. And a broker can tell you what that would cost. And I was wondering, as I was kind of writing some of the stuff deep into the night, wondering in what cases might you as a hub be able to access competitive pricing if you're bringing a bundle of programs to them. I know there are rules around health insurance pricing, and you have to have one employer. I don't know what the rules are around some of these other things, but I would imagine that if you've got 20 childcare programs all using the same product, or 100 programs, that could bring some benefit in and of itself. So I took a stab at this table, but again, up for discussion, right? So we were just working with a group in Indiana, and they were all struggling around the same issue. And we said, well, tell us who we don't have contacts in Indiana. So Amy and I said, tell us who some of your organizations use. And they gave us the names of some people, and we called them up and said, talk to us about the services that you provide. And we found somebody that was, really smart and a good communicator, and we knew all the rules in Indiana. And so we brought him to the meeting of these alliance leaders and said, talk to us about what the options are, right? So so what I'm suggesting is a similar kind of activity of you being the connector for your programs to the brokers. But maybe it's that next step as well. Maybe it's actually facilitating, you're the ones having the contact. So I don't know, I'm opening the floor.
Go ahead, Carla. And I had asked Carla a question in chat, if she had a sense of why folks weren't accessing the benefits broker that had been vetted for them. Is it, so you mentioned a couple of things, but I mean, it could be time, right? That the directors just don't have the time to make that call. It could be sort of some disbelief that what is going to be presented to them will be affordable. And I guess it could be also like, a sense of, a disbelief around like that this can change.
Yeah, I also think in Arizona, there's been a negative thoughts and feelings about the ACA, the marketplace, right? So I think that has also been really negative. For many years, we couldn't even get plans here.
Yeah.
So a lot of the conversations I tried to have last year, even statewide with DES, we did a couple of webinars, and was trying to even just get that they subsidize it. We have plans now, and just kind of reframing some of the thinking. I really think that a lot of it is just that psychology piece for our providers. Even the few that were like, yes, give me the number, I'm going to do it, didn't end up doing it based on time, or that feeling, understanding that it's important. And so I really think this year we'll have better success if we start earlier, and if we facilitate some of those meetings for staff. That comment in the chat was interesting. I've been hearing we're running a health support line for the state on their workforce grant, their stabilization grant here in Arizona. And every conversation that we've had with providers about using that money and investing in benefits for, 401ks, health benefits, gets flipped to my staff. They don't really want that. They want things like gift cards, so really even just that change, trying to shift to something more sustainable is very difficult. So I think for us and for our providers, there's a lot of capacity building that needs to happen. And we probably, sometimes I make the mistake of, oh, we have this great information, let's give it to them, and they're going to embrace it in the same way that maybe I would or we would. So I think we need to do a little more follow-up, and I think the chunking for our providers, you know, here's the goal. You say you are sort of interested in this. Are you? Here's how we can make it happen, and then facilitating that. I don't know if that's helpful, but I think that's where we're at here in Arizona.
Yeah.
That's an interesting comment, Paula. People don't think of Marketplace as real insurance. And who do you think, is it the teachers? Is it the directors?
It's the directors.
Both?
So we have this group of providers that we meet with quarterly from around the state that we just sort of like talk through ideas with. And we have been talking a lot about health insurance and leading up to our EAP launch. We talked about this idea of, you know, of navigators and the ACA and all the subsidies right now. And directors are saying back to us, like, that's not real insurance. And I almost wonder if it's like, obviously we know it's real insurance, it's good health insurance, but the psychology of like, wanting their, it's sort of around, I think I thought a lot about that after, and I think it's like this, we're in this field, this low wage workforce where we know there's not a lot of good benefits, and the ACA feels like it's not a real workplace benefit. It's so, I'm not explaining it very well, but like this director was saying, first, she didn't feel like it was going to save any money. And secondly, she felt like her staff wouldn't see it as a benefit she was giving to them. They would feel like because she didn't offer them insurance, they had to go and get like, which she didn't say, but probably she meant was like government insurance. And, you know, and there's a lot of Wisconsin that is a rural, you know, there's a lot of layers to the ACA that have nothing to do with the coverage or how much it costs or how easy it is to get.
Yeah.
Well, let's just put it on the table. A lot of people call it Obamacare.
Yeah.
Right?
Yes. Yeah.
Who the
Absolutely.
hell wants Obamacare?
Right. Yeah. So I think,
yeah. You know, that's so interesting because in a sense, she is right that if her employees have to get subsidized healthcare, that's something that she's not doing, but there actually is, I think, a strategy that sort of addresses that. Part of it is in this broker, but I want to jump forward. I think I froze.
Your sound is kind of popping in and out.
Yeah, I think I froze. Is it better now?
Oh, I didn't have you. Yes. Yeah.
Okay. So I'm going to pop ahead to the HRA slide because I think that is a really nice way to supplement. Is that okay with you? Let's go back one. So, all right, how's my audio?
It's okay. It's good.
Okay. So this is one of those kind of newer strategies that we're kind of learning a lot more about. And basically, if an employer is not paying for the health insurance, but the employee is accessing free or reduced health insurance, there is still a role for the employer to pay that can be an enormous help. And it is, and I'm still not clear about all the differences between the HRA and the HSA, the health reimbursement versus the health savings account. And that's exactly why we need to tap into the expertise of a broker, or actually Civitas is really a great source to help us come up with some strategies for this, right? But the idea is that even if your health insurance premium doesn't cost you anything, you still might have a copay, you still have to buy medicine, you still have other medical expenses, vision, dental, other pieces. So if the employer then is able to set up or facilitate setting up accounts for each employee and make a contribution to that, that is real money that belongs to the employee that they can use to pay those bills. I think it's a fabulous strategy. And it also, I believe, in some instances has a tax benefit for the employer, right? See, this is where I'm just, so Amy, feel free to jump in, or anyone who knows more about this.
I mean, I think that it is true that it does get confusing because we've all heard HSA or HRA, right? And not fully understood either, most likely. I know I haven't. And but you know, I think the point here is that we understand HRAs as the most flexible option, right? Because these HSAs need to be combined with the high deductible plan. And so you can still be an employer who doesn't know the health status, the health insurance status of your employees. You can still be an employer who does not actively connect your employees to an ACA Health Navigator. And you can be a Shiro by having an HRA plan that you offer. It's a benefit, it's a real benefit. It's costing you money, must be budgeted, right? But you get to control how much money it's costing you. So you can decide, I'm allowing every full-time employee $500 a year in medical expenses. I'm allowing every full-time employee and her family $500 per family member and per employee. You can, you know, say it's going to be $200 or $7,000, right? And so this is a place where you need to write the plan. You need to have staff sign off on it, on their participation, and then you need to vet the documentation that they provide. And so it's a role that's sort of sitting there waiting for, you know, an Alliance Hub to scoop up. So this was our sense of what could happen, you know, that the Alliance, you guys have, you know, your finance department, you have, you know, computer systems, right? You could consult with a lawyer, you consult with Civitas. We can work together as a group if you want to pursue this. But you know, the idea would be that you would be offering technical assistance. Everyone needs their own plan document, right? Because Carla might want to give 500 per employee, but I might only want to give 250 per full-time employee, right? So we each need our own plan. We each need our own staff to sign off on their participation. And then, you know, we each need some help in administering the paperwork of it, right? We still are going to have to write the check. The check for reimbursing folks has to be a check from our business. But if we have a system in place, someone else does the vetting of the receipts or the expenditure that's been made to confirm that it meets the IRS guidelines about what's reimbursable through an HSA account, that it falls within the time frame, you know, that it identifies the person, that person or employee hasn't already reached their limit. So, you know, we could come up with an online form or an online system that all the alliances use or something. You know, doesn't have to be terribly sophisticated. But I think the big barrier to this benefit is that it requires each employer to establish a plan. And then to administer, you know, just sort of approve the requests and then tally, just like you would do with how many days of vacation has Sharon taken this year. You'd have to keep track of how much have I reimbursed Sharon this year? Has she reached the limit of her HSA or not? Those are barriers that I think the hub can help alleviate.
Yeah, I think this is one where the role of the hub is a lot clearer, that you would play a back office / administration role, because it's not realistic to think that a director could add this to their set of responsibilities, but it could lend itself very, very well to a hub role. And there is a version of this for family childcare. I didn't put all the detail in, but it's really advantageous for family childcare providers to use this strategy because it allows them to shelter more of their income from paying taxes on. So it's putting money in their pocket.
So is Civitas just helping out thinking through the legal side of things, or Amy, you've mentioned them a few times.
Well, actually, so some of this is so Civitas is working on kind of this was just serendipitous timing that Sharon and I were, getting all excited about diving in very in a more prescriptive way around educator compensation and workplace environment. And in the midst of that, we also wanted to learn about the lean recruitment strategies. That is a Civitas it's a side business, if you will, something they've been doing for a long time. And it's a recruitment method for finding staff. And there's nothing magical about it. It's just a strategy, and it's something that again, hubs could offer some training, or Civitas could offer some training, just another way so that people don't need to feel victimized by the challenge of being understaffed. But so in the midst of that conversation, we were talking about how excited we were about this idea of, really creating some standards or expectations around benefits. And Gary started talking about the 105B, the 105A, 105B. Anyway, it's the numbers that mean HSA in the IRS tax code. And so it turns out that he had been doing a lot of research on that legislation, and not necessarily thinking about it from an alliance perspective, but thinking about it, provider to provider, because he's out there doing, he and his team and his colleagues are doing the business coaching one-on-one. So we've been thinking with him about this. He's trying to work on a kind of a brief paper, a brief how-to guide, or it's some basic information. What is an HSA plan? Why is it beneficial? What do you have to get done? He has in his draft like an attachment that's a sample plan document, just to give you the idea of how straightforward it is. I think we could work with him to create a sample, what kind of form would an employee have to create? So he's totally willing to partner with us around how do we make this work for alliances? How can we build up the expertise of alliances to take on that administrative role? And how can we help alliances and hubs sort of talk about this, which has some complexity, but how can we help them sell it, to members?
And it's totally legal. But I've just never even thought about doing this within an alliance, that you could be the administrator of an HRA
You can be
or HSA,
you can be the administrator,
Or whatever it is.
whatever it is.
So that's another piece, is that typically that's a cost to people. Like, of course, in our capitalist society, there's somebody out there that's willing to do anything you need as long as you pay them, right? So there are plenty of companies out there that are like, we will administer your HSA plan. They're the third-party administrators. They're not the employer. It's not their plan. I mean, I worked for years at a place that had a flexible spending account. At first, we were a smaller organization and our HR department did it. But then it got outsourced to a third-party company. So, I mean, I don't know. I don't think you need anything other than an organizational status. You don't need a license that says I'm an HSA plan administrator, but we have more research to do.
We do work with a third-party benefits administrator. We've partnered with them on a few projects in the past, but they're a national company. They're called TASC, TASC. They've always been willing to come to the table with people thinking about things. So if you want me to connect you with them,
that'd be Great.
Just, so our organization, WICA, we use a third party benefit. So like, I just didn't even think that, I thought surely you have to have some sort of license to say, yes, these were Band-Aids you spent this money on, and now we will give you the $250 back, and it's confusing and there's lots of paperwork. And sometimes I'm like, is it even worth it? Because I'm a person that hates paperwork. Like, yeah, I want the tax benefit, but if I have to save and mail in every receipt, like I'm actually not even going to do this.
Yeah. Well, and that would be great. I'd love to talk to Task about it. I mean, if there is a third party administrator that can, somehow, because again, we don't need to keep recreating the wheel as alliances either, right? So there could be some things that we have a national third party administrator. We have national, just like there are national CCMSs, right? For folks that want to automate. We're not asking every alliance to develop their own automation solution. So yeah, it's a different way of thinking. I wonder if.
Yeah, so I'm going to just turn the screen off for a few minutes so we can talk. Maybe I am, maybe I'm not.
Yeah, no, you did
Okay.
it, Shannon. You're good.
Okay, all right. So, so those were some ideas. What do you think? Can you see a path to be more prescriptive about expectations, and at the same time maybe more involved in direct service in the delivery of some of these benefits? How is that sounding? What are the things that would keep that from happening?
In
Go
Go ahead,
ahead.
Audrey.
in our area, I just feel like anything new, that's what we experience with Wonder School, is such a leap to get them. For example, just to talk about the Wonder School project, which is like way on a lower level than what you guys are talking about. They initially had a requirement for this. So just to let you know, Wonder School is a place where parents could find centers, and then they could set up a visit at the center, but that it also took care of their attendance, and it received payments for the site. So that's basically, in a nutshell, what it did. And one of the requirements that they wanted the sites to do in order to participate is they wanted the parents to put in their payment information into the system, and for it to automatically pull the money from the parents' whatever account they chose on a monthly basis. And so we worked on this project for 2 years, and my goal was, the first year was 20 people, 20 sites, and then they extended it another year, so I was allowed to add another 20 sites. A year and a half into the first year, I signed up 17 people. And once they took that rule off, that you didn't have to share financial information, then I signed up the rest of the 40, because they did want the service. They wanted people to be able to find them. They wanted to make their attendance easier. They wanted parents to be able to pay through an app, but just not on a weekly basis or a monthly basis. But as soon as I took that, so sharing of information is a big deal. So to me, there was like almost a 2-year trying to teach people what this was and what it was going to do. So I see a big barrier, is all I'm saying.
Mm-hmm. Mm-hmm.
And I think data is part of it, Audrey, because when Sharon and I were talking about this community of practice, and some of it, I think some of it too is not every project views its role or relationship with providers in the same way, right? So not even every project that calls itself a shared service alliance views its role with providers in the same way. In my perfect world, an alliance hub feels responsible for and with all of their members, right? If a member, that they're not going to sleep well at night if they don't know what the enrollment information is at each of their providers, if they don't know what the bad debt is, if they don't know if those providers are fully staffed or not. It's this sense of shared responsibility. It is not a legal responsibility. It is not, financial, unless there is, a provider fee, a membership fee that's being paid. So I think that's part of the challenge here. So if you're an intermediary who feels this sense of responsibility with and for providers, then you are sort of already programmed to be thinking about data and the fact that you need access to this data. And it's not quite so scary, or you don't necessarily feel squeamish and saying, oh, gee, I'm not the employer. Why would I be talking to all those employees about, their health status or whatever? Well, yeah, you're not the employer, but you have a lot of information about every employee, and you have a lot of information about, the business itself. And if you see a need, and a way to help that business and those employees and employers succeed, then why not? It's awfully tough. I know it's tough. It's so tough when people say, and we see it all the time. We saw some, data that came from providers, and it was in Indiana, actually. It wasn't a ton of them, but it was like 5 of them that answered all these survey questions. And they said how troubling it was to do all these different administrative functions, and how troubling it was to do all these admin functions, and how troubling it was to do all these, HR, fiscal, the whole Megillah, the stuff that, an alliance is can be so capable in terms of providing. And then it got to questions of like, do you want help with that? And it was like, no. They had just explained how it was so hard, so time consuming, so stressful. Do you want help? No. So
that is the same reason I think we had problems with the Wonder School, is because they're piecemealing their accounting, so to speak. And they don't want people, they're afraid they're doing it wrong, and they don't want to get in the middle of doing it wrong. They're afraid, and or they might know. So they're afraid that somebody's going to find something, especially with family day homes.
Yeah.
Well, I think also, if you just think about like this particular workforce, somebody who's always been their own boss, right? Has always been doing all of these things on their own. And Audrey, you're right. They have a system, whether it's a perfect system or not, they know how to run that system. So getting them to change practice is particularly difficult. And then also, I really think, I think we could spend all of our time talking about psychology, and I think it's worth it to some degree, because then you also think about that word of prescriptive or like required. It doesn't matter what CCMS it is. Like I remember when we first started our tiers, we had tier 2, and we said, listen, if you want to be in tier 2, you have to use ELB. That's like the requirement to get into tier 2. And we had very low enrollment. As soon as we lifted the requirement, everybody wanted ELV. Everybody said, wait, no, I want that, but because we were telling them they had to have it, they didn't want anything to do with it. And that was the most fascinating thing. I can't even make this up, but as soon as we said, no, you don't need to do it anymore. Don't worry. you realize we're pushing you too fast, or, it's the way you go about change, how you are walking somebody through change, what your goal is, but really how you're going to get there, particularly with people who have been going it alone for 20, 30 years. That arc of change is going to be really difficult.
So Paula, I completely hear you and I believe you. But earlier we also talked about how when policy says you have to do something, it makes people do something, right? The other
Totally.
force out there is market, right? Like people have gotten pay increases because why? Because they had to, because people won't work for $12 an hour and an hour anymore. So there are these other forces,
Yep.
and I don't understand how they all play in, but I think these
you're
are
totally right. Like,
Yeah.
if it was curious saying like, you have to have this, like, there would be no, yep, I'm going to do that because this is telling, if
Oh.
licensing says I have to do this, like, I'm going to do it. So, but
I
it's
think
this
that-
choice piece, I'm not sure.
I
Yeah.
think the higher pay thing is collapsing our childcare system in our
Well,
area anyway.
It is.
Yeah, because the
It is.
parents can't, the parents are just either not working, deciding not to work, or for whatever, one parent is staying home or whatever because they can't afford childcare, because childcare has went up. And so, yeah, I think it's kind of sort of collapsing the childcare.
So
our
Audrey,
area.
is that, so what you're saying is providers who have had to, they've had no other choice but to increase pay, have also had to increase tuition. That was one way to do more pay, was to increase tuition, right? And
Right,
so
right.
that kind of pulling the ground out from under those programs.
Mhm.
I mean, unfortunately, there could be other ways to raise salary. I mean, that's one of the things we want to explore together.
Right.
Raising tuition is right in some instances. It's not always right, and it's not always the only answer. So what are the other ways to raise salaries? And that's kind of the conversation that we're trying to have together, right?
And, one thing I wanted, this is not, this is a delayed response to something. I apologize to send us back, but just because certainly it's of note that we have 2 AEYC affiliates on the call, plus our, beloved Sharon with all her AEYC experience. But, and AEYC, of course, pardon me, NAEYC, of course, as a national sort of trade association, this is one of the things that they do, right, is trying to pull people together and figure out what are the benefits of membership, what can we offer at a discounted price, what kind of agenda can we set forth in order to, show our value. And in some places, it's very forward thinking, very long term, like power to the profession. And in other things, it's like, hey, here's, buy life insurance through us, or, because you can get 2% off, right? So I think that this isn't an either or, it's like the Alliance Hub as a long-term change agent and as a model, and talking about or asserting goals, or talking about how it works at your organizations, right? So at, the United Way, we have an HR department, or we have a finance department, and we have an IT department. And we know that when we create a budget, we have about 25% of salary is added to that budget. That represents the value of our benefits. Here's our benefit summary, right? Like, it's not done to make anyone feel shame or less than, but I think it's asserting what, and we know small businesses work very differently, regardless of their line of work. It's not just childcare. Any small business, every small business would really be foolish to offer their own health insurance if they weren't legally required to do so. It's a really good business decision to connect people to the ACA. But, you know, it's like, I just think that kind of trying to set that stage for what could be a part of what an alliance does, different from here are the services and here's our value proposition to you today in the here and now.
Mm.
That's really good. I just have to say to Audrey, because I'm feeling, I gotta hold some space with her. I just want you to know that we took 4 months to onboard providers for electronic signatures. I just need you to know that we got stuck in the state of Arizona for 4 months on electronic signatures. So the capacity building is real. And I just have to put that out there for you. I also want to tell you, all of you, about data. When we talk about data, here's just a lesson learned for you. That word alone freaks folks out, right? Data, governments looking. We had providers, even though we clearly explained to them, that thought their subsidy worker could see their ProCare. You know, we never said that to them, but that was, you know, something that they created in their head and were really afraid. So we just have tweaked our language. We haven't changed what we do, but we talk a lot about, instead of data, we say program information. Instead of, we're gonna do analyzing all of your ProCare information, we say, we're gonna collect some surveys. We're gonna look and help you with what we see on your ProCare. Nothing changed. We just tweaked the language a little bit, because when we were using, we're going to collect your data, they were like, whoa, I'm out. So I just thought I would share that lesson learned. And we're doing nothing different. The providers are clear on what we're doing. We just changed some of our wording.
Interesting. So I have a question that's related and a little off base. How many of you are planning to go to the NACCE conference in DC in November? Are any of you going?
We're sending a ton of staff, but I'm not sure if Kelly and I are going to end up going or not.
Okay. The reason I'm asking is because Amy and I are actually going to do a pre-conference session, a 3-hour session on this topic. And it is, I have to make the title shorter, but right now, Amy, so you know, the working title is something like Moving the Needle on Compensation, Shared Services, Power to the Profession, the Pandemic and Technology, Creating the Perfect Storm. But I have to make it shorter, I know that. Anyway, if it's in your plan to come to that conference and you are going to be there on Tuesday, you know, further down the road, we'd love to talk about having you be a part of that presentation. That is assuming that there ends up being some value to this community of practice, which just listening to you guys talk to each other, it sounds like there really is. It sounds like we're planting some seeds and we have a lot of homework to do. But before we move to next steps, what is in your head about your questions, ahas, anything that you want to share or ask of one another?
As far as your response, Sharon, to Iowa AEYC being at NAEYC, we would not be able to make a pre-institute session work. My leadership team and I come in together. However, if there was time to have a conversation, a lunch or something, or a cocktail after to have further discussion from maybe things that came up at your pre-institute session, I would be interested in that with my leadership team. I have an outgoing and an incoming president at this point in time that I think it would be beneficial for both of them to hear it. My second thing, and then I'll be quiet, is just, you know, insurance has not been our industry. Early childhood is our profession. And along the lines with what Audrey said, I just wonder how long it would take us to run a survey of the state and who's already performing navigator type services to make those connections, those relationships, which I'm sure WICA has already done with their shared services models over the years, but to not step on toes and to not duplicate services, at least on that piece. And I know that's a small piece of the shared services, but an important thing that our
Yeah.
workforce is missing.
Do you think anyone is doing this kind of work with the early childhood community, or you just absolutely don't know and that's why you wanted to put it out
Well,
there?
knowing that 52% of the community is low income, they're receiving some type of guidance in this arena somewhere, right? So whether it's with community action agencies or Department of Health and Human Services already, many of them are already receiving some. The directors themselves, other than their personal lives, probably not.
Yeah.
Hmm.
Yeah. I think that's one of the reasons why we want to encourage you to encourage your program leaders to ask about health status. Although it does sound like whenever they ask the question, well, so we've been at, it's all about the questions you ask, isn't it? You're making me think, right? So we've been asking the question, do you offer health insurance and what percentage of your employees take it? And those numbers are just all really low. This is why it would be so helpful to ask the question, do you have health insurance? And how are you covered? And if so, how? Because then we would know. And our sense is that a lot of people are going without it, but maybe we're wrong. Maybe staff members are going to the marketplace on their own and getting it. I don't know. That's a really good point.
I also wonder if, again, we all have limits to what we know. We have limits to what we're comfortable with. We all have opinions about what we think is valuable. And we all have different experiences with like telemedicine, right? And I know that Wika has done, a lot of work with Docs by Phone. And I wonder if the business owners are really aware of the power of telemedicine. It has limits, no question. It's not everything, but I wonder, do you feel that, it is affordable? It can be extended to the entire family. Do you think folks get it? Have they used it? Have they used it personally? Do you all have any sort of horror stories or great, wonderful stories about telemedicine? I'm just curious.
We've mainly gotten really good feedback from folks who have used it, English speaking folks who have used it in Wisconsin. But getting them to use it, I think is what you're saying, Amy, getting over that first hurdle of like, and for us, like we cover the cost of it for members in tier 2 and tier 3. And we also share, like this is very affordable. But we have gotten really great feedback, even around the teletherapy, like the amount of time somebody has to wait. We did have some pretty big stumbles with the Spanish speaking services, but we have continued to work with them. And I think they've made a really great strides. This is the telehealth and teletherapy through the CCA for Social Good platform. Obviously, there's many. I've actually heard of one that I've been curious about. I think it's called Nice Healthcare is what it's called, because it's all telemedicine, but then they'll send a person out in that state to get vitals and do like blood draws and stuff. So it's slightly more comprehensive, which is intriguing to me. And I don't think it's that much more expensive. It's maybe $20 per person. So, I think it's all just about like the amount of times you have to talk to somebody about something and in the different ways before they finally are ready to say yes.
Yeah. Part of the reason thank you for that, Paula. Part of the reason I was curious about that, and I've been thinking about it, is because we're trying to connect to this. We're trying to solve this pain point with and for the providers around staffing shortages, right? It's not a direct, we don't say offer health benefit, offer access to the health navigator today, and tomorrow you'll be fully staffed. That isn't how it works, right? So we're offering like a longer term solution to an immediate problem, which is always going to be a challenge. But just trying to really join these pieces together. So I know we have, I believe it's a Pennsylvania company, but I'll look this up and double check, called Vitable, where they will offer some on-site blood draws, as you're saying, vaccinations. They will do on-site physicals that are required. So if you're hiring someone who does not have health insurance, they're not going to pursue employment with you if they have a choice between you and someone else, and the someone else doesn't require them to go to the doctor and pay to have a physical, right? But if your employer says, we want you to work here, we need you to have a physical, and we can send this nurse practitioner to your home to give you the physical, and it's free to you, right? So, or we can have the nurse practitioner come on site the day that is your start date. So I'm wondering if some of that kind of connects more directly to this issue of how do we affordably onboard staff? How do we make the job itself, an easier one to say yes to and to get started in?
So I want to welcome Kathleen. Kathleen, do you want to say hello to people? I'm sorry that you were not able to be here earlier. That might not.
There we go. Sorry,
Yeah.
I was having a hard time turning my mic on. Yes, I'm
So
sorry I
when-
couldn't be here.
When we started the call, Kathleen, we just, oh, there you are. We had everybody just kind of say a little bit about themselves and their alliance or their sort of project or group of providers. So we shared a little bit of your data in your absence, but we didn't give much background on the Battle Creek Shared Service Alliance. So if you want to just say a couple of sentences about that.
Sure, it's interesting. I was coming off another call where we were asked about when our organization was at its best. And I said, I don't think our organization has been at its best yet. We still have a long way to go. So we're getting there. But so the Battle Creek Shared Services Alliance was started about 6 years ago. We currently have 4 centers that are members. We've just started another one we're just doing billing for them. We're going through a transition right now where instead of we've only offered full membership up to this point, and now we're going to be offering some steps to membership so that we can provide some services that maybe people need if they don't need all of them. So we're going through that transition right now, and there's still a lot of room for growth. We're struggling. I came in on the data piece, and I was interested to hear about what you were saying about data, because that seems to be where we're struggling, getting data from our centers. And it's likely to cost us one of our grants that we've relied on for the last couple of years.
Mhm.
So it's just tough. I come from the K-12 world, and so we use data all the time, and we're finding that that's not the case in childcare. So
you'll be happy to know that we recorded this session, Kathleen, so you can we'll send everybody a copy of the recording so you can you can hear what the whole conversation was.
Great, thanks, I appreciate that.
Yeah, we want to spend a couple minutes talking about the assignment for next time though, because it's a biggie. It's the salary scale. And we want to make sure that you are comfortable, that you understand the expectations and are comfortable, and that you can reach out if you need help. So actually, let me share the screen and I will go to the next slide. So it's due back to us by 9/12. Amy sent that document out in the original email. We're happy to share it again. And hopefully you noticed that the document has, we've tried to align it with the power to the profession work that's been done. So I think we added an entry level, right, Amy? And then we have levels 1, 2, and 3, because we recognize that there are folks who are going to come in with, you know, sort of brand new to the field and not the credentials. But anyway, we want you to basically fill that out, and at the lowest end of the salary scale, we want you to sort of look around at your local market and, you know, kind of figure out what are entry level jobs. So, you know, childcare may be paying $12 an hour, but if Wendy's is paying 15 or 16, you probably 15 or 16 is probably your minimum wage in your market. So sort of do that, a little bit of research to figure out like the retail sector, the service sector, those entry level jobs. At the other end of the spectrum, you should be using salaries that are on par with your K-12 sector. And you should be able to go and see what local school districts around you are paying. It's your decision whether you want to, you know, pick a particular community or average it across the state or however you want to do that. But the idea is to just get comfortable kind of going and finding the data points and populating it, because that's a really important piece of work that you are going to want to offer to Alliance members. If we're ever going to do better on wages and working conditions, we've got to start talking real numbers about what pay ought to be. And that may be a harder conversation than data. That may be even scarier. Or technology, salaries. So do you have questions or thoughts about that?
I know everybody's in a different place with their data collection, but you know, obviously it's an interesting, we imagine it will be interesting to see what you come up with and how that relates to the information you've collected from your members or provider community about what their lowest salaries are and what their highest. Again, we didn't ask them, you know, based on credentials and degrees and roles and responsibilities, but
Right.
Even as a broad parameter, that should be interesting.
And so just to be clear, we want you to create a salary scale that is what it should be, not what it is now, right? Everybody gets that, like, so we're not asking you to go and fill it in with our particular challenges, but what's the aspirational, what's our pro forma, what do we want this to look like? Because our premise is we can't really we can't calculate the cost of care until we know what the labor costs are. And we can't know what the labor costs are until we know what salaries ought to be. And then we'll build in for benefits. But so this is our task. Your mission, should you decide to accept it.
Exactly.
Anybody old enough to know what that's from?
Sadly.
Definitely.
All right, so if you will get us a salary survey filled in for your community by September 2nd, we will plan an amazing time together on September 12th. Right, Amy?
Yes, and we absolutely will. And I think that, you know, if nothing else, you are really helping Sharon and me think about, even if some of these strategies are longer term, we really, really appreciate it. And if you decide to try something out or you have some questions in the meantime, let us know. We'll get back to you with the slide deck, the recording, and make sure that you all have some basic contact information about each other. But yes, we promise an excellent meeting on the 12th.
And just, I heard some interest and intrigue around this idea of becoming an administrator for a health supplemental account. Is that something that we should poke around and see? I mean, we could find out from Gary. I don't know when we could offer it, but if people wanted to do some real content driven meetings in between while this is going on, we're happy to set that up. So were folks wanting to know more, Paula? Okay. I mean, we can talk to Gary more about, I mean, it may be that we want to offer something even outside of this group, but Amy and I will put our heads together and figure that out. If there are other topics that you want to know more about, please send them to us.
Yeah.
Would it be possible to get the calendar holds for the next however many meetings just sent out ahead of time?
Sure. We
Thank
were
you.
kind of trying to incentivize you guys to send us the data.
Ah,
Trick.
my calendar is just like, if I did put a hold on there
Yes.
for it, but people sometimes will even book over if I just have something as a hold.
Okay. We will send those meeting notices. We can just send it as a calendar notice for a meeting without the Zoom invite even.
That's all I need is
Yep.
just something that says I am unavailable at that
meeting.
time.
Absolutely. And Paula, I'm gonna do a little research on task. And if it seems like it would make, if you don't mind sending me your contact person, and if it seems like it makes sense to talk to them in the meantime, we'll do that too. I know November, crazy. All right, we will get it together.
Thank you, everybody.
Thank you. Take
Take care.
care. Bye.
Bye-bye.